please tell, as a doctor, as somebody who has worked with millions of patients, have done tons of applications for financing, is there anything like DentiPay in the market? And what is specifically DentiPay is offering to the market that is non-existent and that is going to tremendously benefit both dentists and patients?
So me as a UCLA lecturer faculty, I do research on everything, right? I'm a fact-based human being. So I said I want to see on the market everything that resembles cherry cream. And I signed up with most of them. I play with them. I offered them to my patients. The number one problem is the practitioner, the doctor, and the patients are blind, totally blind. I think the most important thing about DentiPay, it brings intelligence. The underwriting algorithm is totally different than others. It's not a bank. If a care credit is a bank, it's a synchrony. Synchrony, I might be wrong in my numbers, but let's say $70, $80 billion company. DentiPay taps into $500 billion available funds. So the amount of people they can fund and the intelligence they use. So imagine a Newport Beach patients who come in with a fancy car, and but the car is financed. Okay, they live in Newport Beach or Coronel Del Mar, but they're paying a rent, and they bought so many things that they're not credit worthy. When you see them, you spend an hour explaining the whole treatment to them, but they are broke. Okay, so the patient gets frustrated, and you are as a doctor are frustrated because you want to help them, but they don't have the cash, and they don't qualify with the traditional methods. What DentiPay does, it goes deep into the intelligence and it says, okay, you might have this problem and that problem and that problem. Give us some time. We're going to apply for you. We're going to apply for you with an underwriting understanding of the market that the patients don't understand. I'm a doctor, although I'm a business owner as well. For 36 years, I run businesses, dental practice business in multiple countries. You really want to see how much can we finance this patient for the treatments they need. That's really important. They need. So I think nobody has that. And one of the first questions dentists ask, Adam, is can we invest? You know, when somebody says, I want to invest in a company like DentiPay, that is beyond satisfactory. It is that they understood the concept. So I think dentists will be investors. I think dentists will be providers for patients. But we have to be cautious to make sure quality is there. American public is used to buy now, pay later. What they're not used to is such level of intelligence and comfort where you go to your dentist, you're pre-qualified, the dentist knows most of your issues, if not all. Of course, there are no x-rays. No x-rays, no radiographs means no treatment plan. I can say, hey, Dr. Charles, for example, myself, we have a patient for you by the name of Natalia. She's very sophisticated and, her concerns are everything. She wants to have a beautiful smile. She wants to be comfortable, blah, blah, blah. So I know that I have a demanding patient in front of me. Right. As opposed to somebody who comes, a guy who has no teeth, right? And says, I just want to eat. Well, the way you approach that patient is totally different than a very sophisticated person who says, I want to have all of the above. Did I answer your question?
Yes. Now, Dr. Zahedi, can you please tell me approximately if right now DentiPay was completely integrated in your practice with all the capacity of the intelligence, how much time do you think you personally and your assistants would save with a patient in general, and how efficient do you think your practice would become?
That's actually an extremely good question. The more successful you become, the more you're going to have of one problem, and one problem is time. Time. My only problem in the last 20 years was time. I don't have any health issues, I have no money issues, but time issues. As you know, in my new business model that we're going to expand to the rest of the country, affordable dentists, we get a very large number of new patients. Okay? Hispanic, non-Hispanic, different walks of life. I need to use my 36 years of reading people to get to know what they want. So I lose an hour per patient. There's only a number of hours in a day. But if you want to then do surgeries on this patient, then you are not seeing new patients. Because surgery can, as you know, take 2-3 hours easily.
Yes.
Even in my case, I'll work easily 14 hours a day. There's only so many hours left to do the consults. Now, interestingly, what you pointed out last Sunday, we are Sunday today, a week before now, I signed a contract with a lady who has 30 years of experience in office management, dental office management. And she started to work in my office in Santa Ana and Newport Beach. And she said, oh my God, Dr. Zahedi, you have so much potential of making a lot more money while helping patients, while keeping the treatment plans extremely affordable and competitively affordable. But you have lack of manpower, not in quantity, but in quality. Yeah. So if you put an ad on Indeed, you get 1 million people who speak Spanish and want to work, right? You have a lot of dental assistants. You go ad on Indeed, I want a dental assistant. Okay, the first day 150 people apply. How many of them have the intelligence to do what AI does, what Echo does? You know, like analyze the patient, look at this smile, and how much money you save. You know, so it's a multi-approach advantage. It's like there's not one advantage.
Yes.
So when you taste, I will use the word taste, DentiPay, is great because then the doctor says, okay, now I have a patient. Before sitting down with the patient, I actually know their creditworthiness. Are they totally broke? Are they homeless? Their credit score is 450. They have $2 billion in debt. Or is somebody with a credit score of 750, 720, and they might apply for $20,000 and they will get the approval. So the patient doesn't get frustrated. Doctor doesn't lose time, which is the biggest problem of their successful doctors. So I don't see any compelling argument that any dentist in this country can use to say DentiPay is not for me.
Yes.
I still have to see somebody, and I will challenge them because